Heart disease is a major cause of illness and unfortunately the leading cause of death in this country, but it especially is a problem for the African American community. I'm Dr. Randy Martin, and I'm pleased to be joined by another cardiologist, Dr. Winston Gandy. Winston, thanks for joining me.
My pleasure, Randy. How are you?
African Americans have an increase in really risk factors for heart disease. Tell me a little bit about that.
Well, as you know, that cardiovascular disease is the #1 killer. And what we find is that it disproportionately affects several members in our communities. What this basically boils down to is what we now are aware of is disparities in health. And in the cardiovascular arena, unfortunately, the African Americans have the largest gap between outcomes and treatment opportunities than majority Americans.
Winston, when you say disparity of health, what do you mean?
Disparity just means a difference in outcomes. And theoretically, if we are all seeing the same physicians, then one would expect that we're all treated the same.
Right.
I will be very adamant in saying I don't believe it's discrimination, and I think the data would bear out that it's not discrimination because we notice these differences amongst all treatment groups. So what we have to look at now is for years we've identified these differences, these problems, these bad outcomes. It's now time to really focus on how do we make a difference.
If the African Americans do have a disproportionate incidence of certain risk factors or elements of heart failure, what are they? In other words, is it lifestyle? Is it genetics? Is it all the above?
It is, to a large part, all of the above. You know, African Americans have a very high incidence of systemic hypertension. We happen to live in the southeast here in Atlanta, and it is known as the stroke belt. So yes, we see a lot of that. What we've found out is that you can make a difference in changing the outcomes if you educate the people.
How do you begin that education process for both the patient and the doctors?
Well, you know, the main thing is that you have to educate the patient just to ask the question, doctor, do I have high blood pressure? For the most part, patients are passive recipients.
Since you're talking about educating the patient, what advice would you give to the patient when they go to the doctor?
I advocate 5 questions to your doctor. Doctor, do I have heart disease? Doctor, do I have high blood pressure? Doctor, do I have diabetes? Doctor, do I have cancer? And doctor, am I going to have a stroke? Oftentimes, it's just prompting people to do the right thing.
For HealthWatchMD, I'm Dr. Randy Martin.